Alden is an active, fun-loving 12-year-old who had a rough start to life. At 3 months old, he began having seizures.
His body jerking, acting not normal, kind of turning a little blue around the lips.
Alden's seizures became more frequent, and each one could last more than a minute.
He used to have them in the very beginning just when he slept, but then the seizures got worse and worse, and he started having them throughout the night, throughout the day. There were no triggers, they just happened whenever.
Doctors at Seattle Children's diagnosed Alden with epilepsy, a brain disorder in which neurons misfire and cause seizures.
So in the beginning, he was on one medication, and he would have these what we call honeymoon periods where he would last a couple of weeks without having seizures. And you think, oh, this is great, no more seizures ever again. But then with pediatric epilepsy, because they grow, babies grow, and they grow so quickly, they outgrow their doses, so they start having seizures again.
Doctors tried multiple medicines, a special diet, and still Alden kept having seizures.
With 5 medications on board and having a ketogenic diet also on board, he was probably seizing 15 to 20 times a day.
At 19 months old, Alden became a candidate for surgery to remove the area of his brain from where the seizures originated.
We can pinpoint exactly to within a few millimeters or a centimeter exactly where the seizures are coming from.
Dr. Rusty Novotny, director of the epilepsy program at Seattle Children's, says advances in imaging make it possible to see not only exactly where misfires occur, but to map an individual child's brain to know which parts of the brain they might be able to do without, which could be safely removed.
Often brain function has already switched to different areas. So we can identify that now with these newer imaging methods. And so normally, 90% of people who are your language is on the left side, but if you had a developmental anomaly on that left side, your language may be on the right. And so now we can know that even before the surgery.
Based on what advanced imaging allowed them to see inside Alden's brain, doctors at Seattle Children's suggested something radical for Alden, a hemispherectomy, the removal of half his brain.
So Alden had seizures that were not controllable with medication, and there really was no other option in sight that had a hope of getting rid of the seizures. And we're not even talking about a reduction, maybe there would be a pill that would cut it in half. But in his case, you had to do something radically different in order to make a difference in how he was going to grow up. And so the hard conversation is always tempered by the difficult reality. And the hard conversation about what we're going to do to this entire half of the brain comes with it the hope that you can actually get rid of the seizures.
We were shocked, floored with the thought of putting your child through a radical brain surgery to remove one hemisphere. But for us, it really wasn't, should we or shouldn't we? It was more, when can we do this? Because he had no life.
Alden's parents were in.
We were all in.
Dr. Jeffrey Ojaman performed the 8-hour surgery to disconnect and then remove most of the right hemisphere of Alden's brain, from where all of his seizures were coming.
So in a very simple way, there's one area that's firing abnormally and the rest of the brain's just fine. And so you turn off the noisy television, or you take away the place where all the storms, where all the seizures are starting, and then the rest of the brain can function normally.
After recovering from surgery, the healing and therapy began. The remaining half of Alden's brain had to be encouraged to do the job of 2 halves. One of Alden's eyes was patched, so his brain was forced to learn to use the other eye. One of his arms was put in a cast, again, so the remaining hemisphere of his brain would make the other arm work.
Open.
When hemispherectomies are performed on very young patients, the brain seems to adapt well to hardly miss a beat.
Yeah. Nice job. The brain is an amazing, amazing organ.
Alden has some balance and peripheral vision issues and is still a little behind his classmates academically, but he is an otherwise healthy, happy young man.
I mean, he's walking, he's talking, he's writing, he's reading, he's doing math, and he's being social, just like a person with both hemispheres.
And by the way, no more seizures.
He has not had a seizure for 10 years since the hemispherectomy.
Not one.
Not one.
For Alden, the hemispherectomy was not just a treatment for epilepsy, but a cure.
A new life. Definitely the hemispherectomy saved his life.